Dr. Calvo, maybe you can answer, get your input on this too, from this question. Since there isn't an FDA-approved treatment for HER2 mutated lung cancer yet, where should targeted therapy fit into the sequence for when to give it?
Yeah, this is a very interesting question. And if we look back, we've been asking that for most of the new drugs. They do show activity in early studies, usually heavily pretreated patients. And the question is, where does it fit? I can tell you there is a publication in New England from January this year about 91 cases of HER2 mutated cancers that were pre-treated with chemotherapy and had no standard treatments left. And when they were treated with trastuzumab deruxtecan, the response rate was very robust at 55%. So if I have a patient with HER2 mutation that runs into that situation, I think the answer is clear. You want to use it for second, third, fourth line. But the biggest question is, can it be a more effective drug if you use it in earlier phases, similar to what you do with EGFR? And I think that's the trial Jeff, you mentioned earlier in your presentation, the studying the effects of that medication in first-line therapy of these patients.
Yeah, I agree. I think we need to wait that trial, and we just don't have evidence to date yet treating patients up front with specific HER2 targeted therapies.
If history repeats, if you have a 55% response rate in second, third, fourth line, I can almost guarantee you those patients are going to behave like the EGFR patients or LK patients with very high response rate. The question is the toxicity going to be a problem? And, we don't want to assume, we want to actually try it and do it.
Yeah, exactly.
Okay, so the one question is, are there any upcoming trials and medications to look forward to? And the answer is yes. There are trials with a new NTRK inhibitor. I'm not gonna dare to remember the name, but I believe it has an L in the, so stay tuned for that one. Because we're seeing all these ROS1 inhibitors that have greater CNS effect and also higher response rates in the second line in patients that were treated with TKIs before. So I think that's what is showing improvements.